Chronic thromboembolic pulmonary hypertension is a disease that happens most commonly in patients who have suffered from an acute pulmonary embolism or blood clot in the lung. In some patients, even when they're treated appropriately with blood thinning medication, the body is unable to break down the clot, and the clot in the lung turns into a chronic blood clot or scar tissue that remains in the blood vessels in the lungs and affects the way the heart and lungs interact with each other, leading to symptoms of persistent shortness of breath, persistent fatigue, exercise limitation, and eventually, if untreated, a type of heart failure called a right-sided heart failure.
What's really nice about the CTEPH program at Northwestern Medicine is that we are truly a comprehensive multidisciplinary care team. And so that means we have both heart and lung specialists, so cardiologists and pulmonologists, along with expert radiologists who focus on reading the imaging that's required for CTEPH patients. And then of course our surgeons who focus on CTEPH management every day are very skilled and have done a lot of these surgeries that we want to offer our patients. Given that we have experts in multiple areas, we are able to review all testing on our own independently with an eye for making sure that we're reaching the correct diagnosis of CTEPH, seeing if the patient has any competing conditions that might impact the best treatment strategy for them, and then understanding, the overall risk benefit for patients based on how much disease they have and are there other conditions that will impact the likelihood of success for surgery or ballooning procedures.
Building this program has been quite the journey. We started in 2015, 2016, and it was 3 physicians here, an interventional cardiologist, a cardiothoracic surgeon, and myself, a pulmonologist, that got this program up and running. Over the next decade, we've really grown this program into a premier CTEPH program in this country. We recently completed our 200th pulmonary thromboendarterectomy surgery and our 500th balloon pulmonary angioplasty session. These are major milestones that show large volume interventions for patients with chronic thromboembolic pulmonary hypertension. We spend a lot of time and effort making sure that patients have access to care at Northwestern. So we have a team that is dedicated to working through insurance issues, working through access issues to try and get patients here to see us to be able to partake in the care that they need to treat their underlying disease process. If you have a patient that has chronic thromboembolic disease, or if you have a patient that you suspect may have chronic thromboembolic disease, it's as easy as a telephone call or an email to the nurse coordinator, and then we will take the reins of trying to get appropriate imaging sent to us, get the patient's information sent to us, and get the patient in the door to be able to be seen and evaluated appropriately for their underlying disease.